In the following video, you get to know a disease just heard of in horror stories about vampires. When we think of vampire folklore, we tend to be reminded of several qualities that signify that someone or something is a vampire. Aside from biting, vampires are also known for avoiding sunlight, hating garlic, and having long, sharp fangs. Vampires have existed in myth and folklore for hundreds of years and have a well established place in popular culture. Just look at the Halloween costumes, and you will find vampire capes and plastic fangs among the witches, skeletons, and ghosts. However, did you know that there is a real life disease that can explain some of these unnatural symptoms? Sometimes known as the vampire disease, porphyria is a blood condition that has sparked some of the key characteristics of vampires. There are many connections between the symptoms of porphyria and vampire characteristics. Firstly, vampires like to avoid the sun. Individuals with porphyria have photosensitivity, meaning that their skin is extremely sensitive to sunlight. When the skin is exposed to the sun, they can develop blistering skin lesions that are painful. The skin lesions can eventually lead to scarring as well as changes in the skin pigmentation. It is advised that individuals with porphyria should try to avoid sunlight to protect their skin if possible. Secondly, vampires drink blood. This may have been thought up due to the result of red or brown urine in patients with porphyria. Alternatively, some have said that before modern treatments, physicians had recommended that patients drink blood to compensate for the defect in their red blood cells, although the recommendation was for animal blood. Lastly, the idea that vampires have fangs and hate garlic may have come from this disease. Repeated porphyria attacks can result in facial disfigurements and cause the gums to recede. Where does garlic come in? Due to its high sulfur content, garlic could trigger attacks in people with the acute forms of porphyria. Porphyria refers to a group of rare disorders that result from a buildup of natural chemicals called porphyrins in the body. Porphyrins are needed to make heme, a part of hemoglobin. Hemoglobin is a protein in red blood cells. It carries oxygen to the body's organs and tissues. 8 enzymes are needed to change porphyrins into heme. Without enough of any of these enzymes, porphyrins build up in the body. High levels of porphyrins can cause major problems, mainly in the nervous system and skin. There are two general types of porphyrias. Acute porphyrias start rapidly and mainly affect the nervous system. Cutaneous porphyrias mainly affect the skin. A few types of porphyrias affect both the nervous system and the skin. Porphyria is usually inherited. One or both parents pass along a changed gene to their child. Although porphyria can't be cured, medicines and certain lifestyle changes may help you manage it. Treatment for symptoms depends on the type of porphyria you have. Doctors classify porphyrias in several different ways. Besides defining by each specific type, doctors also classify porphyria in two broad categories. Acute porphyrias. Onset is rapid, symptoms last a short time, but they may come back from time to time. Most often, acute porphyrias affect the nervous system. Cutaneous porphyrias. Only the skin is affected. Doctors also classify porphyria by which body system becomes overactive. Erythropoietic porphyrias. The bone marrow produces porphyrins in higher levels than normal. Hepatic porphyrias. The liver makes too many porphyrins and porphyrin precursors. What are the symptoms of porphyria? People living with cutaneous types of porphyria, which affects the skin, often experience symptoms including oversensitivity to sunlight, itching, swelling of a skin exposed to sunlight, abrasions, blisters on the skin, skin erosions, scarring of sun-exposed areas of the skin leading to fragile skin. Symptoms of acute porphyrias include pain in the abdomen, chest, arms, legs, or back, nausea or vomiting, constipation, urinary retention, inability to empty bladder completely, mental status change including confusion and hallucinations, seizures, muscle weakness. Porphyria most often results from genetic mutations passed down from parent to child. You are more at risk for porphyria if a parent has this disorder. Unlike the other types of porphyrias, porphyria cutanea tarda (PCT) occurs when an active acquired disease like hepatitis C or human immunodeficiency virus (HIV) becomes active in the body. The disease's activity causes a deficiency in the enzymes needed to produce heme.
One in a million people whose genes lack the ability to process sun exposure, explains the camp nurse Joan Cepas.
They have no way to fight it off. It's like putting an ice cube out in the sun, it just melts. They get burned.
After Katie's diagnosis, the Mahars were devastated.
It dawned on me right then and there that she's going to be alone the rest of her life if we don't do something.
No? No what?
His parents saw the first signs of that when he was a premature baby in the NICU.
They put you under the UV lamp. It actually ended up burning his entire body.
Turns out he has a condition that only hundreds of other people worldwide have had.
Congenital erythropoietic porphyria. We call it CEP.
Some say it's where the legend of the vampire originated.
He produces red cells, but they die really quickly. We're getting blood transfusions every 7 to 10 days.
On sunny days, he has to stay inside. Luckily, his big brother is usually right by his side.
How is porphyria treated? Treatment for porphyria depends on the type of porphyria you have and your symptoms. For people living with cutaneous porphyria, avoiding sunlight is key to recovery. Your doctor may also recommend that you avoid substances like alcohol that trigger symptoms. Some people with cutaneous porphyria benefit from the therapeutic phlebotomy. This type of blood draw reduces the amount of iron in the liver. Treatment for acute porphyria involves intravenous IV heme or glucose infusions, adding heme or glucose directly into a vein. Other drugs are under investigation and may be available through clinical trials. Dietary changes, including eating high amounts of carbohydrates and calorie-rich foods, also help manage symptoms. Patients with acute porphyria who have severe symptoms or who have other types of porphyria may require more invasive treatments to manage symptoms. Treatment options may include blood transfusion, surgery to remove the spleen, and liver and bone marrow transplantation. Thank you guys for watching the video. I will introduce even stranger diseases, so subscribe and I will do my best to surprise you.